has there been any updates on the vaccine for COVID-19?
Well, it's a lot of like clinical trial threes that's going on. There has been things that's been talked about in the news recently, like, oh, we may have something even before the start of the election. You hear that we'll have something by the end of the year. So it's a lot of things going on, and it's a lot of clinical trials that's being conducted even within our state, up there where Dr. Feldman is, down here where I am in Detroit. So I'll let her chime in.
No, I was just saying that we just announced we're starting, in a clinical trial, and that information, if you're interested, is on, if you do University of Michigan or Michigan Medicine COVID-19 vaccine, you can see, because we are taking volunteers. We just announced it today. And it's one of three major, vaccine trials that are ongoing in the United States. In the one we're doing, there are 30,000 patients who will be entered throughout the country. Henry Ford is also involved, as are we. And so I think I'm optimistic that because there are three large trials ongoing and they each have good, ideas behind the vaccine. There are three different types of vaccines that we should, I'm hopeful that something positive will come out in the shorter term rather than in the longer term. So sooner rather than later.
Mm-hmm.
So just for those of us that are not familiar with vaccine creation, what does a phase 3 trial mean?
Phase 3 trial is that a person will either receive the vaccine or the person could receive a placebo. In certain vaccine trials, so everyone is actually receiving the vaccine. And then what you look at in this case is if you look at the incidence, how many people get COVID who have gotten the vaccine. Now that's how it's being done in these large trials. And so it's not like you get the vaccine and then you're subjected to COVID, like go out and try to get COVID and see if the vaccine stops you. That's not how these trials are going. You get the vaccine and then you're just monitored over time. That's the reason the trials must be so large. If you did a trial where you got a vaccine and then you were exposed to the virus to see if you get the virus, the numbers could be smaller, but that would probably not be ethical.
Right. And then Dr. Young, could you explain what happens, how many more phases do we have after a phase 3? Because you had mentioned about, that there's some news reports that we might have something in November before the end of the year, so for those of us, just so that we understand timelines with vaccine creation, Dr. Young, what do we have after phase 3?
Well, I will chime into Dr. Feldman when she's mentioned the word placebo. That means that they're not receiving anything. So,
thank you.
Not to say,
yeah, sorry, but that isn't going to happen with these trials. Everybody's going to get vaccinated.
Right. And so then that means like, okay, give somebody water instead of juice. Just juice with them. So just saying that. Dr. Feldman can answer that one better because I don't know what their plans are with it, but this phase right here is a really important phase.
It's the last phase. So you have phase 1, phase 2, phase 3. And if it's effective, if it works, if the vaccine works, then what happens is the FDA has a panel that looks at the results and approves the vaccine. And then traditionally the CDC works with the company that makes the vaccine to distribute, to get the vaccine out to all the different places it needs to go to.
Right. And so that's great because some people in other countries they've been skipping phases, or maybe it's like, oh, let me add another phase. But this phase right here is the most important phase.
And it's the last phase.
Yes. So it'll be final.
Great.
And so with that, with the health department, we come from the state, everything we are waiting for those approvals that Dr. Feldman was talking about, and so that we can go ahead and provide it. And we're looking at who's in higher risk categories and the more vulnerable and things like that. So we are getting ready for it. And so we can go ahead and deploy as soon as possible.
Are there any risks in getting the flu shot for people who may have never gotten it before? Any risks for children?
Okay, I would say no. I know that this has always been a problem. People do not want to get the flu shot. But when the pandemic first started, it was flu season then as well. And so then it was a lot of things about, oh, do someone has COVID or do they have the flu? You know, but with any type of medication, you see some people might be allergic to eggs, so they should not take a flu shot that comes with eggs. I know I have been hearing conspiracies like, oh, they want us to get the COVID vaccine, but it really is still gonna be the flu vaccine, or it's maybe it's gonna be a combination. All that stuff is still being, done, but it's right now it's gonna be like something, separate. But the risk is always minimal, so we don't say it's a 0%, but everybody health elements are different in how they may respond. But I do highly recommend getting the flu vaccine. Some people say, oh, I get sick since I get the flu vaccine, but that's, they may have a cold that was going on, then something else had happened or whatnot, but it is highly recommended and we highly encourage it. And that's one thing that's going to be happening from the health department as well, is to encourage everyone to get the flu vaccine, and that could help minimize, a COVID type of reaction perhaps if they was to get it.
Great. What new developments in rapid testing, and when are there new developments in rapid testing, and when will Detroit have new types of testing available?
Well, it's been a lot of different research when it comes to the testing. So we have the PCR rapid test with the Abbott lab. So that means someone can come to the health department and get the testing done, and they will know their results within 15 minutes or so. I'm sorry, did the camera freeze? But so we have rapid testing here at the health department at 100 MAC. And that's the quick one, it's a safe one, it's an efficient one. And so that's the only one we're gonna have right now because we have multiple instruments that we can use. And when it comes to other testing, we're not in a process right now because this one is a confirmatory test that can be used. There's been some hospitals that may have been doing, or urgent cares that have been doing antibody testing and things like that. And that's about looking at immunity when it comes to things. But the health department does have a rapid testing, and an appointment can be made so that people can get it done. We did a lot of the testing when it came to first responders, police department, even essential workers at the grocery stores, so you can make sure it was safe. We actually did do the testing for the kids that went back to school in the summer. So we're doing the testing here, and it's the rapid test, which is a very efficient test.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.